Okay, using data from scientific sources. So, according to the Arkansas Department of Health, they used information from the BRFSS or Behavioral Risk Factor Surveillance System. And Arkansas in 2020 was found to have, by gender, male smokers 22.2%, female smokers 18.8%. Now, compared to the United States, this is using 2021 CDC data. The males were 13.1% and females 10.1%. As for age, so for both Arkansas and for the United States, so at each end they were lower based by age, and then the highest was typically around the middle age. So for Arkansas, 2020 data, 18 to 24 years old had a 12.9%, and then the peak was at ages 35 to 44 with 30.4%. 65 plus was the other end at 11.7%. Now, smokers in the United States followed the same trend, but at lower percentages. So they started at 18 to 24 at 5.3%, peaked around a little bit higher than Arkansas at 45 to 64 years old, and they peaked at 14.9%. And then at 65 plus, they went back down to 8.3%. Now, as for race, Arkansas smokers from the BRFSS had white smokers at 21.3%, black smokers at 19.0%. As for the US, they had white smokers at 12.9%, black smokers at 11.7%, and then they also listed Hispanics at 7.7 and Asians at 5.4%. Now, I'm not sure if the Arkansas Department of Health didn't have enough data on other races and ethnicities, but they did not list anything other than whites and blacks. And then for the Arkansas um, household income, and the US, they both followed a similar trend of the lower income, the higher percentage of smokers. And so the more money you make, the less likely you are to smoke, the lowest percentage of smokers. Then as for overall trends of comparisons, the current cigarette smoking among adults from the BRFSS in 2020 compared Arkansas and the United States. So Arkansas was 20.5% smokers, while the US was 15.5. Okay. So as for these results that I found, these results seem logical because of multiple factors. So things like access to healthcare could be limited in Arkansas. Arkansas is pretty rural, so with limited healthcare access also comes limited knowledge regarding health and familiarity with proper wellness and educational measures for things like smoking and smoking cessation programs. And with that also cultural norms can also play a part. So if you live in an area where everybody smokes, nobody really goes to the doctor very often, may be more likely to smoke and participate in these cultural local norms and be resistant to change, regardless of whether if you know smoking's bad for you or not. SES can also play a part in this. So, a lower socioeconomic status can provide stressors and financial burdens. These can cause the individual to be stressed and want to participate in activities like smoking to reduce that burden. Now, um, Aside from the well-documented role the tobacco industry has played, what are some reasons that I think that tobacco-related products and cigarette smokings are still apparent, although we have evidence? So I think that cigarette smoking, tobacco-related products remain a leading cause of these negative outcomes because of the accessibility of buying them. So in the United States, cigarettes are very easy to buy. You can get them at gas stations, grocery stores, convenient stores. It's very easy. And in some communities, like dry counties, they can be significantly easier to buy compared to alcohol. If you're before they raised the limit to 21 years old, if you were 18 years old, you could easily ask a high schooler, an older high schooler, to buy cigarettes for you if you were younger. You didn't have to know somebody that was 21 years old. The price of cigarettes is also fairly accessible. Although cigarettes are expensive if you smoke them a lot and you're constantly having to repurchase them, typically cigarettes are about $5 to $7. So all it really needs is $10 at the time. So I think that is some of the reasons why that it is a leading cause. Now, what type of cause do I best think describes cigarette smoking? So regarding the necessary and sufficient causes, I believe category C, not necessary but sufficient cause, best describes cigarette smoking. Cigarette smoking is not required for lung cancer or these negative health outcomes, but when present, they can cause a negative outcome by itself. In the direct and indirect cause, I believe that it is the direct cause. A direct cause has a causal pathway in which there are no intermediate steps. Okay. As for reduction of disease, so total prevention is never possible due to things like genetic components and environmental exposures. Diseases are multifactorial causes. So, for example, diseases have multifactorial causes. For example, smoking can cause lung cancer, but so can breathing in specific chemicals on a job site. Drinking can cause liver disease, but individuals can develop liver disease who have never drank in their life. As for public health issues in the future, one public health issue we'll still be working on in the future, I believe, is obesity. So, obesity can be reduced by healthy eating habits and proper exercises. And this is an issue because it's related to other health issues. So, type 2 diabetes, cardiovascular disease, these are issues that can be related to obesity. And this is present because we have we have unhealthy foods available. We have fast foods, highly processed foods, foods that have way too many calories that we sell at the store.